I'm Eric Saviano. I am with Nebraska Appleseed, and my job there is to be a program associate for our economic justice and healthcare programs. I also get to run the Enroll Nebraska Coalition, which is a coalition of enrollment assisters that help people apply for and apply for the Affordable Care Act, marketplace coverage, things like that. So maybe I'll add one or two things to what Bon said specifically about coverage through the marketplace. The general eligibility for getting subsidies through the marketplace is 138% of the federal poverty level, up to 400% of the federal poverty level. Those guidelines are probably in your packet somewhere, or probably easily accessible online as they change each year. I don't have the numbers right now, but anyone above 400 or below that is still able to buy on the marketplace. They just don't get the subsidies. They don't get the financial assistance to do that. And that's not cool. But Medicaid expansion in Nebraska is one positive thing that's happened since last year we did this training. It has actually passed via the voter ballot initiative in 2018. So we're excited about that at Nebraska Appleseed. We helped pass some of that, or get some of that happening. But one more thing about Enroll Nebraska as a coalition. Like I said, we were a coalition of enrollment assisters that work statewide. And so if you all who are working in Lincoln, probably, maybe a little bit farther away than that, have any questions about who else in the state is doing enrollment assistance, in Lincoln, Bon is the person to go to, definitely. You can also reach out to the federally qualified health centers all over the state. So that's the 7 federally qualified health centers. I think Columbus, Omaha, I should not have started this. Columbus, Omaha, Scottsbluff, Gering, Lincoln, and more. So you probably know those also. A Google away. All right. Oh, thank you. Yes. So Anita and Jeff and Bon are all part of that coalition too. So they're going to remind me what to say. Yes, so 211, which is United Way's referral phone number. It's free to access anywhere in the United States, really. But the one, if you call from our area, you get transmitted to the United Way of the Midlands 211 Center, and they will tell you anybody who is close by doing the enrollment assistance. These are folks who are paid to give the free assistance, unbiased. They're not agents or brokers. So they're not getting the commissions and guiding people to plans that make most money for them. They're helping out with whatever needs come in the door. So good deal. If you want to look online, you can go to enrollnebraska.org/local to find a local enrollment assister to give that free service to your clients. So another cool service we offer. I think, as Bon said, we're starting, promotion should be happening right now around, we are sending out some template materials, some flyers, some basic one-page postcards, English, Spanish, that will have some more information about the marketplace on it, or where to go to find more information about it. But if you're interested specifically, you're going to have my information on here, and I can get your organization a blurb that you can easily customize for your stuff. Okay, Anita, you had the last good idea. Any more? No more good ideas from Anita. Thank you, though, for that good one. Okay, so I get to talk to you a little bit about the status of Medicaid expansion in Nebraska. I think I'm a nice person to talk to about it, because we were one of the advocacy organizations that helped get the petitioners out and get it through the finish line and passed by Nebraska voters in 2018. It had been an effort that we were eligible to apply for as a state for 6 years. We attempted to get it passed through the Nebraska legislature. Our governor could have done it himself as well. But we started off with really close to getting it done, and every year we brought a bill, it got a little harder, and more people were against it. Of course, your politics probably help make, it's a politicized policy for sure, but it is one that would impact a ton of people in our state, and one that would really affect equity for the lowest income people. I mentioned that 138% of federal poverty level. Individuals without, who can't get pregnant, for one, and who are not age disabled or fit into any category Nebraska uses for Nebraska Medicaid, those folks did not have access to health insurance. It was too expensive, is too expensive, and they don't have many options. So Medicaid expansion was one way that we are getting more people covered in our state, and hopefully not taking the medical debt or the personal pain and anguish that comes with not having what you need for health. Please raise your hands if you have questions at any point through this. I'm going to go through it, see what we do. All right, so I think you guys covered this mostly in the morning. This is a refresher though. Eligibility in Nebraska is different than eligibility in Colorado for Medicaid. Even among states, I think the 13 or 14 who have not expanded Medicaid, all the eligibility for that is different. In Nebraska, this is the eligibility criteria for us. Not just having a low income is important, but having an income that is low as well as fitting into a particular category. I think we already mentioned those. Having a child, being a child, immigration status, very low income, seniors, people with disabilities. I'm lucky I have these slides because I haven't memorized this, but this is some of the basics about income eligibility for Medicaid. It leaves a lot of people out. Just to reverse track, yes, so generally people who are low income but do not fit these categories don't have options. So 90,000 individuals in Nebraska is the estimate that has come to the top. It's changed a little bit every year, usually gone up, but estimates estimate that about 100,000, 90,000 people would benefit from Medicaid expansion in our state. These are adults without children, most are working, and it would cover people under that 138% of the federal poverty level. Originally, Medicaid expansion was a requirement of the ACA. Someone took it to the Supreme Court. The Supreme Court decided that it should not be a requirement, but an option for states. Okay, those are some basics. Here's a question, yes? All right, so we care about this issue at Nebraska Appleseed because it affects a whole lot of people, and we care about low-income individuals getting health insurance and having what they need to succeed. This is a huge policy, one that has been, like I said, 35 or 36 states have taken up and expanded. So people in Iowa coming over the border, moving over into Omaha or anywhere else in the state, they are shocked usually to find that Nebraska does not have this option, whereas other states do. It's an inequitable system. These are the folks that would benefit. 90,000 folks in Nebraska. Jobs, retail, service, personal care, food service, construction, waiters, waitresses, folks out working hard labor every day who don't have access to insurance through their jobs. There's 33 states, I'm wrong. But everywhere across the state, folks around this would benefit from this. All right, so we did take this to the legislature. We did the standard processes. We tried to make the economic argument. We made the heart argument, right? Showed people who need and would suffer if they didn't have Medicaid expansion now. Didn't happen. Took it to the ballot and it passed. So 54%, I believe, of people in Nebraska voted yes, and Medicaid expansion passed. After that, the Department of Health and Human Services and the governor decided that they would use 23 months to enact the Medicaid expansion that was voted on. So in every other state, the longest it's taken is 10 months. And so it's pretty clear that the governor is using this extension of the plan to slow it down because it's not something they want. So what we are doing right now is, well, they've had to submit certain things to the federal government to approve, and some of their proposals are getting rejected here and there. So I want to give you just a state of the proposal as it is. October 2020 is the projected coverage date. 2 months before that, August 1st, 2020, is when people will be eligible to enroll. That's the state's timeline. You may have seen in the news that we recently filed a lawsuit to ask the state to enact by the end of this year. And that is because after this year, the state will receive only 90% of the federal match for services provided under expanded Medicaid. And if it happened during 2019, that'd be 93%. Some language in the ballot says that they have to maximize federal participation. And so we think that means they should do it this year. The courts, of course, are a slower process. We're kind of not thinking that we'll have a decision by the end of the year, because what is it, October? So it is something that we're continuing to pursue, but hopeful. Okay, so the other part of this, besides the implementation date, is that the proposal brought by the Department of Health and Human Services proposed to move people out of regular Medicaid and into what they call Heritage Health Adult Plan. You may have heard about the prime coverage and the standard coverage. Does anybody recognize that language from your state Department of Health and Human Services? No? Prime? Basic? Okay, so that proposes that if people do certain activities with the Medicaid, like have a home health provider and attend a wellness appointment, you get prime coverage. So you get certain benefits that, like dental coverage or vision coverage. And if you don't do certain things like that, or you don't make appointments that meet the requirements or do the work requirements that were included, then you go to basic coverage and you lose some of those benefits, such as vision and dental. So,
is it going to be across all of Medicaid then, or just for the expansion?
The original plan was to include at least 23,000 existing Medicaid patients in that plan. But CMS has told them, we're pretty sure, that they can't do that. So there's some things they've proposed that they've said they can't. Now, I think they're planning on doing that only for the Medicaid expansion population. Good question. Okay, so that's one thing that has changed since they first introduced this. Now, I think our office helped write the ballot initiative. Nowhere in it does it say that you should be changing and adding work requirements and adding things that help people not get dental and vision coverage. Actually, it said things like you can't take things away from the existing participants. Obviously, we're a little slanted here. We disagree with the state on their interpretation of this, but quite a few differences in their proposal. A few more things that are not on my slides, but that I just got an update on. You might recognize Medicaid requirements for recertification. They proposed to take it from 12 months recertification to 6 months. And CMS told them no on that too, we're pretty sure. Center for Medicare and Medicaid Services, that's the federal Medicaid administrative body. They also were proposing to take expanded youth services covering age 21, actually 19 to 20-year-olds off of Medicaid. They decided that was something that they should do, but CMS told them they shouldn't do that. This is just FYI, I guess, just for fun. They also said that retroactive eligibility, that was something probably covered by DHHS and something we rely on as caseworkers quite a bit. Go to the hospital when you need care, especially emergency care. You're presumed eligible, and CMS will, or DHHS will cover you if you're eligible for Medicaid 90 days previously. They proposed to cut that to 30 days in this plan, but CMS also told them not to do that, so that's good. And then finally, this community involvement, which we think of as work requirements, was a proposal, actually is a proposal that is still happening in our state. So similar to, I believe it's TANF benefits, ADC in our state, they have implemented a requirement that you have to be doing volunteer activities, work activities, or education for 80 hours a month. And that is still active. Yeah. Okay. One thing I'll mention about that, there are 4 other states that are doing Medicaid work requirements right now. 3 have been struck down by the courts, and 1 is in the courts being decided right now. So I can't judge ours, but hopefully that would be struck down as well. Yeah, I'm so biased. I disagree with those policies. I guess I should say up front. Okay. Oh, that is it. Yes, let's have some questions. Sure. So Medicaid expansion impact. So when this is enacted, these are the benefits that would take place in our state. And they're kind of proven based on those other 33 states plus DC who have taken up Medicaid expansion. 17 folks making under $17,000 a year, which is that 100% of federal poverty level, 138 or so, would be covered. And people with health insurance have better health outcomes, so they would be positively impacted. Our economy, these are those numbers I mentioned that we've run and proposed at the legislature for years and years. Our economy would be greatly benefited as well. Most traditional Medicaid, it fluctuates based on the year, but reimbursements for services provided by Medicaid are reimbursed at around 50% in our state. And the Medicaid expansion population services would be reimbursed at a 90% match. So 10% would be covered by the state, 90% covered by the federal government. So that increase in income would create and sustain in our state 10,000 jobs. Medical bankruptcies in other states that have done this have gone way down, and we expect that to happen in our state as well. And then things like general assistance, like you all were trained on, I believe this morning, right, would be unnecessary. And that is generally funded by income taxes at the county and state level. So generally savings at the state. Some of those folks who are on traditional Medicaid getting 50% or 50% reimbursement would move into the Medicaid expansion category as well and be eligible at the 90%. That's how we anticipate savings for our economy and income.
So, awarded.
Yeah. The expansion population for sure will get 90-10 or 93-7 if we get it done this year. And some of the individuals who maybe fluctuate, who go on and off Medicaid, would be able to stay on Medicaid and possibly be enrolled at that 90-10 match rather than the traditional Medicaid population. Well, I can give you their reasoning. She asked if there's any positive to the state asking for more time. I mean, their reasoning is that they want to get their stuff in order so they don't mess it up. And, you know, we like to think of ourselves as very unique in Nebraska. And I agree, we have some specific things that we're unique ways we structure things. But I guess our argument is 23 months versus 10 months for any other state is unreasonable. Over double.
So 10
Yeah.
months has been the average for other states?
That's the high.
That's the high?
Yeah, it's about 7 months generally.
Is it because they were prepared for it? Or preparing for it?
I possibly. So Utah passed their ballot initiative when we passed ours, and they're up and running now. And they're also a red state. This is getting political, I know, but I think it's your definition of the will of the voters and how you interpret that. Clearly, I'm biased, though. I'm trying.
I think that's okay.
Yeah, so maybe this gets your blood boiling. I think that's okay. I think our goal is to see more people in our state with what they need to live. A lot of government services are designed to do that, and we think that the ballot initiative is a good thing in our state. Some states don't have that ability, so hopefully we will not see obstruction to that coming up. But when that does happen, we hope that they honor that ballot initiative a little more closely.
I don't,
Yeah.
I don't understand it well enough.
Yeah. Mostly I think because of costs and history. I think that the existing Medicaid populations are going to remain covered at the same level. That's how it was written in the ACA when it was passed and when Medicaid expansion was part of it. And the feds really wanted to give health care to more people. And so they created this 90, actually they started at 100%, and it has stayed at 100% reimbursement for 3 years, and then it dropped incrementally. 90 is the lowest it will ever go for that Medicaid expansion population. And even at 90, it's kind of an overwhelming reimbursement rate for most people, or reasonable people. So I think even the reasoning for striking it down was that it was a perverse incentive or something. I could read up on what the Supreme Court said. It was too much for the states to force them into that kind of a situation. That's how you can get in touch with me about Enroll Nebraska or about any of this. Folks in the room probably don't have a lot of spare time, but I bet through your job you definitely don't. But if you want to get involved in a little more related to Medicaid expansion, there are issues to be worked on that the public's input would be helpful to their elected officials. So that's my information. All right, thank you, everybody.